So, are we ready? Are we ready for the second session? Clearly, when you look around this room, this is the house that advocacy built, right? And I mean it literally and I mean it figuratively, because 10 years ago, you'd go to a symposium like this, the room would be full of clinicians and scientists and maybe a table or two of advocates in the back, just kind of listening and trying to see where they fit into the equation. And when you look around this room at these faces and at these lanyards and at this swag and at this research, this is the space that we have humbly been invited to. We're invited into their house, into your house. We're a guest here today. And we're going to hear now some of the blueprints and the plans and the layout of the house that advocacy built. And I am so privileged and so grateful to introduce our first speaker for this second session. The research is clear. Building diversity and access in clinical trials for Black women is crucial. And Dr. Tisha Felder, the Associate Professor of the University of South Carolina, is going to report on the studies of research from 4 partnering and collaborating organizations that have conducted their own research into the disparities into clinical trial participation by Black women. And we're going to discuss some of the findings, some of the moral imperatives, some of the research regarding why Black women are not engaged in clinical trials. And so I want to introduce at this time Dr. Tisha Felder.
Good afternoon. So we're not going to talk about how unfair it is for me to come after Dr. Lola. Can we please give her another round of applause? Thank you so much for speaking so much truth. I want to begin this by reflecting on, so when I was a doctoral student back in 2006, the first project I worked on was called EDICT. It was eliminating disparities in clinical trials, 16 years ago. And today, we are continuing this conversation. What I want to point out about what I'm going to be presenting today, one of the important differences I think that we face now, and even Dr. Moe talked about this, about who's even in this room and how this room was even put together, is that the projects that I'm going to be providing you an overview with, and you'll hear more detail directly from them following my overview, is that this work is patient-led. And I think that there's something to be said about patients providing, not only guiding the research, but interpreting the research. And I will say all the time, as researchers, there's not a single question we'll come up with that would, that patients don't already have those questions and don't already have the answers to. So I'm excited to be a part of this patient-led work. So this overview is about 4 specific projects. The first is Touch Black Data Matters project. The second is the Become project. And just in general, as I go through this, I'll just be hitting some high points and they're going to give you some more specifics. But within these projects, they were focused on Black people living with breast cancer. Some had different sampling techniques. They had different questions that were asked in the work that they did. Some used quantitative, qualitative. So there's lots of different approaches that were taken within these studies. But they all had a lot of similar themes, which is what we're going to focus on today, and which is really the purpose of this symposium, is for us to walk away with those themes and turn them into action items so that 16 years from now, we won't still be talking about this. The third project was increasing representation of women of color in breast cancer clinical trials, which was conducted by For the Breast of Us. And then the final project was Project SOAR, which was an academic community partnership that used a unique approach to exploring the breast cancer context from the framework of the Black woman schema, Black woman, strong woman schema. And if you're unfamiliar with that, it's basically a concept where that really kind of frames the experience of Black women and how we have to have a certain level of resilience and coping in order to deal with being both Black and being women. So the purpose of this synthesis, again, is to give you a broad brush of the findings across all of these projects. This is not intended to be a systematic review or meta-analysis, so you don't have to worry about p-values in this conversation. We're simply going to give you kind of big picture themes that we're going to interpret into action items. So we're going to talk about those themes, and we're also going to point out the complementary results. So again, some of the projects asked different things, and so they had some additional findings that are also relevant to this conversation. And lastly, we want to leave here with collaborative action steps, not just a good conversation, not just a good meeting, but some true action steps. So the approach for this, again, was very broad. Again, it is not intended to be something that's to be published or focusing on anything statistical. It is simply to give us some guidance on the needs, the expectations, and some solutions to addressing the disparities that we see in clinical trials, with a focus specifically on Black people who are living with breast cancer, including those with metastatic breast cancer. And some of those similarities, again, are those questions that were focused specifically on highlighting the issues around clinical trials. So across all of the studies, studies 1, 2, and 3 were basically similar in their approach. They started with qualitative research. They used that to inform surveys. Most of them also conducted the online surveys as a way to collect the data. And then there were different populations in some of the studies. So for some, it was focused specifically on Black people living with MBC, but also included non-Black participants in terms of some comparisons. There were some that included early stage and metastatic. So again, there's a difference in the comparisons, but comparisons were made within those studies for the subgroups of interest. And again, the fourth study, Carrie's Touch, really used a unique model that could be used in the future for patient empowerment. So again, studies 1 and 2 were similar in terms of their approach, questions, and comparable data. And then study 3 took a much broader approach, so including not just breast cancer, people with breast cancer, but also a general population. They also focused on questions around general healthcare experiences. So for example, we're talking about clinical trials, but sometimes your early experiences in healthcare can even shape these later decisions that you might make in terms of deciding to participate in a clinical trial, whether or not you feel that your providers are trustworthy, as Dr. Lowe was bringing up. And study 4, again, used a different approach by having these smaller groups of Black women having these discussions. So these were longer discussions around what their experience was like, framing it within the Strong Black Woman schema. In addition, this project will have some additional data that will be coming out, so stay tuned. And it was not currently included in the synthesis. So let's start talking about themes. So some of the things that we saw across each of the studies was some of the representation. So some of the participants were more likely to have higher incomes, higher levels of education. They were also more likely to have had some experience in being in clinical trials. Another theme that came out that was really glaring is that many times patients have to initiate these conversations with the providers about clinical trials. And that is an area where, again, when we start thinking about action steps, those are some things that we can certainly walk out of here and begin to formulate ways that we can change that. Just in general speaking, there's very little conversation that, at least for these participants, that's going on with their healthcare providers about clinical trial participation. Again, some other themes were some of these similar barriers and concerns, issues of mistrust, or better stated, the lack of trustworthiness around, among these healthcare institutions and providers, and also the financial and logistical issues. These issues are not only themes across these different studies, but these are also things that have been consistently documented in the literature for decades. So again, these show some examples of places where this has been a consistent problem. So there's a lot of opportunity for us to figure out how to take it from just kind of being repetitious to actually making some changes around these things. In terms of motivations, so some of the reasons that these participants would be willing to engage in clinical trials were very altruistic. So some of it was, I want to make an impact. I want to help people who look like me. Other issues around the treatment may be better, so they may have access to the newest treatments, the treatment may be free, and that there's also close monitoring and evaluation of them throughout the trial process. Additional themes were around communication and responsibilities. Again, taking this back to the healthcare providers, the need for more culturally appropriate conversations, information, the why, the what, and the how of the trials, really getting down into the details of what that process will be like for a participant. Further, having someone with a shared experience. I think part of the reason why there's such amazing energy in here is because there's a shared experience among people that are in this room. There was a deliberate effort made to have certain people in this room. And it's the same thing for patients who are interested or willing to consider being in trials, is that if there's somebody that looks like me, there's some connection there that makes me feel a little less guarded and willing to hear the conversation, or at least to consider it. Also using our faith and faith-based support communities to help provide more of this education. And lastly, which was out of study, the study for the rest of us. This was very powerful. I think we know this, but again, this was patient-led research, and this came directly from patients, is that it's everybody's responsibility to address this issue. This is not just for us to empower patients to advocate for trials. It is also the responsibility of clinical research organizations, healthcare providers, pharmaceutical companies, government, all of these different entities. It's everybody's responsibility. And I think part of the reason why we have yet to see some of the change and some of the movement in these issues is because everyone is not invested at the same level. So also the themes around making the trial easier. So again, here's some solutions. The clear communication, easy to use, accessible tools. Sometimes we design things and we think this is a great tool, this is easy to use, but you're not necessarily, again, doing that patient engagement to find out from their perspective, is this something that's helpful? Is this something that's useful? Is this something that's easy to use? The financial side of participating in clinical trials, the logistics around how you're gonna get there, how you're gonna take care of your children if you're in that trial. And then lastly, emotional support. So being able to access counseling, any support that you can get while you're even in the trial to make that process easier. So to point out some of the complementary findings from these different studies. So the first study talked about the emotions and experience when clinical trials are discussed with doctors, the impact of race on care, sources of satisfaction with the care team, what equitable care means. And one part that I feel like was very interesting is the message testing. So this study tested some messaging to see if it was something that would have been motivating for participants to participate in clinical trials. And those are some of the things that need to be done in order to see if people can, to address some of these, again, the barriers, making sure that those messages align with those populations. For study 3, again, was very broad, so not just focusing just on breast cancer survivors, but focusing on all players, early experiences with the healthcare system. Again, it's not, your interaction with a clinical trial is not isolated. You have had other experiences, both positive and negative, with the healthcare system throughout your life, or you haven't had very many experiences with the healthcare system. So all of that context matters when you're trying to recruit participants. And again, highlighting differences in care, healthcare experiences, and perceptions of clinical trial, where there were marked differences sometimes between white and minoritized patients. And with study 4, again, these gatherings, which have great potential for future patient empowerment, Their follow-up surveys showed some improvement in self-care and feeling empowered, again, to have those conversations with the doctors around clinical trials. So as I summarize this and we begin to get into more detail with each of these different projects, I just want to highlight and give some shout outs to some people. Really appreciate the Metastatic Breast Cancer Alliance and Become team, and we are appreciative of all of the individuals and other projects that submitted their materials for this synthesis. I do want to say that you can download summaries of those reports on the Black Women Speak website. So if you scroll to the end, you can download those for free. But we want to especially thank Touch, Ricky Fairley, for the Breast of Us, Marissa Thomas, Jasmine Sowers, and Summer Consulting, and also Reverend Dr. Tammy Denise. Thank you.
That was an incredible overview of And Dr. Felder's being modest. She's a titan in this field, and you have been really the bricks in the mortar that has pulled so much of this study together. I mean, it has been published in ASCO, presented at various meetings, and if you get the chance to read the data, to see the posters, you will understand the yeoman's job of the work that she has done and continues to do with advocacy groups.